South Africa has been recording well over 4,000 positive COVID-19 cases in the past few days. Is a fifth wave about to hit us, or is this the result of an increase in testing across the country? Joining us to discuss this further is Professor Mosa Moshabela, who is the Deputy Vice-Chancellor of Research and Innovation at the University of KwaZulu Natal. Prof, thank you so much for your time and thank you for joining us. I'll refer to that question that I asked in that intro. Are these the beginning stages of a fifth wave of infections?
Yeah, good morning, Togozo, and to the viewers. And, sadly, in as much as I would have liked to say that maybe not really, I think that in the past, when we look at the trend, once we hit the point that we are at in terms of numbers and the metrics that we have not been able to come back from that. We've always kind of progressed into the next wave. So we are assuming that this is actually the seeding of the fifth wave. We are not at a point where we can confirm this yet. We need to be able to monitor the trends and see whether they are maintained or not. And also, we are not at a point where we are seeing rise in hospitalization. It's just the cases and the infections. So we're very much concerned that this is a trigger for the fifth wave. We would have liked to see a situation where the numbers start to come down towards the end of the week and in the coming week. But in the past, we have not been able to come down from the numbers that we have, because the more people you have who are diagnosed, they tend to essentially begin to infect more people. And the testing in the country has not really increased to a point where we can think that this is just a matter of picking up more cases. In fact, our testing rates have been low and continue to be low. So we are very concerned that we are now seeing the beginning of the fifth wave.
I mean, we know that in terms of trends and patterns, more time is needed to analyze the data that's coming in and monitor those developments. But can we even, at these sort of novel stages, talk to what could possibly be behind the surge?
We are not necessarily able to talk to what is behind the surge. We do know that the surge will happen once the opportunities for infections are available. We have dropped the use of masks. We've just come back from Easter weekend. There is a lot more engagement. We've come back from school holidays. There has been a lot of interactions in society where in a situation where the precautions that we were using in the past have largely been dropped. And we also know that even our vaccination is not optimal. We have seen that the variants that we have in the country, it's still Omicron, even though we are seeing what we call subvariants. The sort of, I can call it the sort of variants that emerged out of the Omicron variant that we saw in November, December. This is the same family of that Omicron variant, but we are seeing BA4 and 5 lineages. Those sublineages are the ones that currently we know are driving the pandemic. We are very concerned that we could be seeing a new variant, and we are watching that carefully. But so far, it's still Omicron. It's still the same kind of practices that we know, and therefore we should also know that once we start to see increase in infections, we should know what to do as well.
Certainly. I mean, we know that scientists had predicted that if a fifth wave was, on the horizon, that it would likely land between the months of April and May. We know that the health department is already monitoring these developments and is particularly concerned about the upcoming winter months. What about those seasonal changes would be of concern to South Africans?
Yeah, so there's a number of things that are of concern here in Togozo. I think, one, you're absolutely right that what we are seeing in trends is not unexpected. It has been predicted. And you can see it. It falls squarely on what we have seen before. We have gone through 4 waves of infections. 2 of them were in winter, and we saw this pattern. So we are not surprised there. I think what's different this time around is that we are out of the state of disaster. And for a lot of people, they, believe that, COVID has ended, and that is incorrect. We are still facing COVID-19. And also, we have been seeing a situation where, because we are no longer using masks, A lot of people are presenting with other forms of respiratory tract infections, and they don't know whether it's COVID or it's something else. It causes a lot of confusion for South Africans. And so getting the diagnosis is going to be difficult in this context. Generally, we should be able to test whatever symptoms we have. In the past, we did that. But now people tend to wait before they can, decide whether to test or not. And the last thing that I want to mention there in terms of the seasonality is that, we are concerned that because of the last time we had infection was in November, December, January, there's been waning of immunity, which increases the number of people that are susceptible to Omicron, which is the reason why it is possible for this trend that we are seeing now to actually increase and hold and become a wave. We are only just monitoring the one factor, which is the variants, to see whether there will be a new variant that affects the seasonality. Because for each season that we've had a wave, we had a different variant. But this time we're still dealing only with the sublineages of the Omicron variant that we had in November, December. So otherwise, for all South Africans, really, I think the issue of not using masks and also the sort of more interactions that we have and so forth, these are things that are new to us compared to what we saw in the past, and they can increase the chances of us seeing an increase in the surge of infections.
Prof, you mentioned immunity, and it's got me wondering about our rate of vaccination, the vaccination coverage that we currently have, coupled with the fact that we have had high rates of prior infections. Wouldn't those two factors in any way, ease the impact of this upcoming fifth wave, if it is indeed a fifth wave?
Yeah, when we went into the fourth wave, we knew that our immunity was around 73%, just over 70%, and it was combining both immunity from vaccination and from infections. We suspect that it is somewhere between 60 and 80% at this point. But here's the problem, is that when we went into December, we were also counting on people who were infected in the Delta wave. In the Delta wave, we had a lot of infections. And so that those people who recovered were largely protected in the fourth wave from severe disease. Right now, we have seen with the data internationally that there is a lot of what we call breakthrough infections. So even people who have had Omicron can still be infected again. They may not have severe disease based on the data we have, but they get reinfected. Some people get reinfected even within a matter of 1 month. So we are very concerned that the immunity that we have at the moment may not necessarily be enough foolproof to protect us from infections. What we are hoping for is that it can protect people from severe disease, as we saw in December. But the fact that this issue of Omicron breakthrough infections is so clear across the world, it's concerning us as to how will it affect us here in South Africa. We don't know for sure exactly how it will pan out. But we are hoping, and this is a hope really, based on the sort of indications we've seen elsewhere and we've seen in the past, that the rate of hospitalization will remain low. Vaccination basically has come to a standstill pretty much in South Africa, at about 50% of adults. And we can depend better on vaccination than we can depend on immunity from infection, which is a lot more unpredictable. And so this is our concern. We are waiting to see, maybe in another week or so, we'll begin to see a clearer pattern of how people are responding to the current surge of infections.
Sure. Prof, very quickly, before I let you go, you mentioned that this is, this would, in fact, be our fifth wave of infection. So this would be the fifth time we're having to deal with a surge of this nature. Would you say that we are better equipped to respond to these kinds of surges?
If we were still using the same tools, Dogozo, I would say that we are better equipped. But this is the fifth wave, but it's the first time we are doing it outside of the state of disaster. which means that the tools that we have really do not depend so much on government. They depend a lot on individuals and, what individuals decide to do. So it's really going to depend on the extent to which individuals are going to take that personal responsibility and take matters into their hands. That's a test for us. I would say that from where I stand, that's pretty new for us. So it's very hard to tell as to whether we will deploy adequately the tools that we have. I'm hoping that it does not come to a point where we have to reinstate the state of disaster, that enough people in South Africa will take precautions that can help us avert what could lead to a reinstatement of a disaster. But really, this is the first time that things are solely in the hands of South Africans.
A huge responsibility indeed. Thank you so much, Prof, for your time. That's Professor Mosa Moshabela, who's the Deputy Vice-Chancellor of Research and Innovation at the University of KwaZulu Natal.